All right, folks, buckle up because today we are diving deep into something that I think we can all relate to on some level, and that is kidney stones.
Oh,
We've
yeah.
got this medical paper here called Renal Calculi Kidney Stones,
hmm
and it is fascinating and cringeworthy in equal measure, and we are going to break it all down for you today.
Yeah, I think a lot of people have heard of kidney stones,
Right.
but they don't really know exactly, what causes them,
Right.
what they are.
Yeah, what they're made of.
Yeah, all that good stuff, and we're going to get into all that today.
Absolutely.
So first off, renal calculi.
Yeah,
That's just a fancy way of saying kidney stones.
right. Just a medical term.
Yeah. And anytime you see the word lith,
Yeah.
think stone.
Yes.
So renal calculi, kidney stones, that urolithiasis,
Mhm.
they're all kind of the same thing.
Exactly.
So let's jump right in because the paper starts out by talking about the pain, and the pain is real.
Oh, yeah.
Like they compare it to being stabbed in the back or even childbirth.
It's excruciating.
Oh.
Can you explain, like, what makes kidney stones so painful?
So, you think about sharp edges, and that's certainly part of it.
Right.
But it's really the way that they disrupt the natural flow of urine through your urinary system.
Okay.
So you imagine a tiny little jagged rock
Yeah.
trying to make its way through these small, delicate tubes.
Oh, gosh.
That's just going to cause a lot of pressure and irritation.
Right.
And that's really what leads to that really intense pain that people experience.
And so it can even cause damage if they're not treated.
Absolutely. You can get lasting kidney damage if you don't take care of kidney stones.
Wow. Okay. So we've got these tiny, jagged rocks, as you call them.
Right.
What are they made of?
So most kidney stones are actually made of calcium.
Really?
Yeah, which is kind of surprising because we think of calcium as being good for our bones.
Right. We need calcium.
Yeah, but when there's too much calcium in your urine, it can actually bind with other substances and form these hard deposits or crystals.
So it's not that you're getting too much calcium, it's that it's not being processed.
Right. It's about the balance in your urine
Okay.
and how your body is processing it.
Okay, interesting. And so these crystals are forming in the kidneys, right? And then they have to travel down through the ureters.
To the bladder, exactly.
To the bladder. So that whole journey sounds pretty rough.
Oh, it can be.
So the source also mentions this thing called a nephrostomy tube.
Mm-hmm.
What is that?
Yeah, so a nephrostomy tube is basically a thin, flexible tube that's inserted directly into the kidney,
Okay.
and it allows urine to drain directly out of the body.
And why would you need that?
So it's often used after certain procedures to remove or break up a kidney stone,
Okay.
especially if the stone is blocking the normal flow of urine.
Got it. So it's like a temporary bypass.
Exactly. It gives the urinary system a chance to kind of rest and heal.
Okay, so this is all post-procedure stuff that we're talking about.
Right.
And one of the things that they emphasize is this surprisingly active recovery.
Yeah.
Like they tell you to drink tons of water, which makes sense. But also to strain all of your urine.
It's not the most glamorous part.
It's not glamorous, but I guess it's important.
It is.
And to walk around.
Yeah, no bed rest.
Yeah, no bed rest, which seems kind of counterintuitive.
Right.
So can you explain why all that is so important?
Sure. So the main goal is to flesh out those stone fragments that were broken up during the procedure.
Okay.
The more you move, the more you drink, the better chance those fragments have of passing naturally.
So it's like kind of shaking up a snow globe, you know?
Exactly. You got to get things moving.
You got to get things moving.
Yeah.
And you would think that a massage would help,
Right.
but the source specifically says no massage.
Yeah.
So why is that?
So massage can actually dislodge the stones,
Okay.
but not in a good way. So instead of helping them pass naturally,
Right.
it can actually push them into a place where they cause more blockage and more pain.
So you got to be careful.
Yeah, you don't want to shake that snow globe too hard.
Right.
Exactly.
Exactly.
So let's talk about diet, because this is another thing that surprised me.
Okay.
The source recommends limiting protein, especially animal meat.
Yes.
So no steak.
Not as much steak.
That's tough.
Lameness.
Can you explain the connection between diet and kidney stones?
Yeah, so animal meat is high in compounds called purines.
Purines.
Purines. And when your body breaks down purines,
Yeah.
it produces uric acid.
Okay.
And uric acid is a major contributor to kidney stone formation.
So it's not just about getting rid of the stones you already have.
Right.
It's about preventing new ones from forming.
Exactly. Diet plays a huge role in prevention.
Okay, so what about beer? Because I was relieved to see that beer was also on the list of things to limit.
Yeah.
So does beer also have purines?
Beer does have purines.
Okay, so same logic.
Same logic, less beer, less purines, less risk of kidney stones.
Okay, so we
Yep.
talked about preventing them.
Hmm.
Let's talk about the procedures for actually getting rid of kidney stones.
So they describe two main methods in the source. One is shockwave therapy,
Right.
and the other one is they actually go in with a needle and a scope.
Yeah.
So can you break down those two methods? Like when would you use one versus the other?
Sure. So shockwave therapy, also called lithotripsy,
Mhm.
it's a non-invasive procedure.
Okay.
So no incisions.
Okay.
They use sound waves to break up larger stones into smaller pieces that can be passed more easily.
So literally sound waves breaking up a stone.
Pretty cool, right?
That's amazing.
Yeah.
And what about the needle and scope approach? When would you use that?
So that's called a nephrolithotomy,
Okay.
and it's typically reserved for more complex cases.
Okay.
So if the stones are too large or in a difficult location,
Yeah.
they'll make a small incision in your back and insert a scope with a camera and instruments to remove the stone.
Okay, so it's a bit more invasive.
Yeah, a bit more involved.
Okay, wow. So that's a pretty big contrast between those two procedures.
Yeah, definitely different approaches depending on the situation.
So to sum up, kidney stones are incredibly painful,
Oh, yeah.
but understanding what they are, how they form, and what you can do to prevent them
Right.
can make a huge difference.
Absolutely. Knowledge is power.
Knowledge is power.
Yeah.
It makes you wonder why we don't talk about this more.
Yeah, kidney stones are so common,
Right.
but there's still kind of a stigma around it.
Yeah.
People don't like to talk about it.
Like on a dinner table conversation.
No, but maybe it should be.
Yeah, maybe if we were more open about it,
Right.
people would feel more comfortable seeking help.
Exactly. And they could be more proactive about their health.
That's a really great point, and something for everyone listening to think about. How can we make this information more accessible?
Yeah. How can we break down the barriers and get people talking?
That's all the time we have for this deep dive,
Mm-hmm.
but hopefully this has given you a better understanding of kidney stones.
Yeah. And maybe even spark some conversations.
Exactly. So until next time, stay curious and stay healthy.
And hydrated.
Yes. Drink your water. Lots of water.
All right, we'll see you next time.
See ya.